get admitted to the BMS course in 1986. So it was very tough for the tough days of Ayurveda, I should say. And there were very few books available, very few teachers and gurus available from which you can gain knowledge. And I found this Vaidra Datar Shastriji in Sangli only, my native place. And I worked with him for 5 years. Now this photo or this image, I have clicked this image at Cochin, where at the evening of the Brihatra in Ayurveda. Next. I'll just introduce his simple biography and all these things, that he born on 20th April 1909 in Harane Murud, the coastal village in Konkan area, Napoli district. He studied in Satara College, Ahmednagar College, and passed his Ayurved Tirth in 1932, and he became Ayurveda Acharya in 1938. Now at that time, the Ayurveda Acharya was superior degree. Now you will first degree you will get is Ayurveda Acharya only. So it was a like postgraduate, and the all India exam was conducted to confer this degree. And he practiced in Mumbai, and he's a pioneer of Panchavautik Chikitsa. I will come back to you about this Panchavautik Chikitsa. And he written 6 books, all in Marathi, and he has written 45 scientific articles. And he founded the Vaidraj Datar Panchavautik Chikitsa and Saushodhan Kendra, a charitable trust which works to propagate, to share his work, his knowledge of Panchavautik Chikitsa and in field of Ayurveda. And what our trust does is, we try to inspire the students to become physicians, to practice Ayurveda, to treat the patients. Now that is the main thrust of our efforts. Next. Now coming to today's topic, I think Samir sir has enlightened you so much on Yakrit, but I will just go through some slides. Because when we say that Yakrit Sanjeevini, this is your topic today, and the liver is the biggest organ of our body. Indriya, we say. Panchadasha Kosthangani, and there they have mentioned Yakrit. Now, Shonitavahanam Srotasam Yakrit Pliham Cha. Yakrit and Pliha, they are the seat of the Raktava Srotas. They are the home to the Rakta Dhatu, and not only Rakta Dhatu, but Rasa, Rakta and Maus. The main 3 Dhatus, they have great connection with Yakrit. Then, Dvitiya Raktadhara Mausasya Abhyantarataha Tasyam Shonitam Visheshataschu Sirasu Yakrit Plinnoscha Bhavati. Raktadhara Kala also includes Yakrit. Raktadhara Kala means what? Where the Rakta is formed, all the properties, the functions, its physiology, its morphology, everything depends on the status of Yakrit. Raktadhara Kala iti Purishadhara Kalayaha Sthanam. So all these things are interdependent. See, Ayurveda has a great connection to each and everything. Every word written in Ayurveda in Sanhitas, it has connection with everything. The first shloka is connected with the 10,000 shloka. That is the beauty of Ayurveda. Only thing is, as a student, we have to look for it. We have to make efforts, take efforts, and try to bridge the gaps, bridge the dots, and improve our understanding of what they have done. गर्भ से यकृत प्लीहानो शोणितजो यकृत कालखंडम दक्षिण पार्श्वस्थम प्लीहा अनेनेव नामना प्रसिद्धो वाम पार्श्वस्थिताः. So दक्षिणतो यकृत क्लोम सखलो अप्यो रसो यकृत प्लीहानो प्राप्य रागम उपैति. You have seen the Ranjak Pitta. We say that Ranjak Pitta is in Amashaya. But here Sushrut says that Ranjak Pitta is also in Yakrut and Pliha, which gives the color to the blood. So overall, the references we can find about Yakrut indicate that it's basically a part mainly related to the Mahasrotas, that is Annavah Srotas, Rasavah Srotas, Raktavah Srotas, and Mausavah Srotas. So these 4-5 Srotasas are greatly related, and Yakrut has a great impact on the diseases of these Srotasas. Next. Now as we see that the Rakta is Yakrut and Pliha, and Yakrut and Pliha is Rakta. That's why when we try to understand which factors can vitiate Yakrut, which factors can disturb the function and anatomic, that is structural and functional abnormalities in Yakrut can happen, we have to go for these Rakta Dushti Karanas. So these are Rakta Dushti Karanas. The Charak Sutrasthan 24th Adhyay, you know. So when you go for the modern hepatic diseases and hepatic disorders, you will find all these causative factors which are important in the abnormalities and the diseases of Yakruta. Pradushta bahu tikshnoshna maddair annasya tadvite. See, the madhya, the excessive madhya, alcohol intoxication, in the first line only Charak has written that this is the major cause of liver disorders. Tatha ati lavana kshara amla katubhirevacha kulatha masha nishpava tilataila nishevane pinda mulakadikana haritanam cha sarvashaha. See, harita varga. Today in nutrition and dietetics, all these the buzz is of use the leafy vegetables, pale bhaja khawa, hirvya bhaja khawa, hai na? The leafy vegetables, they have great functions and great importance. No, it is not easy. They are not easy to digest. That's why haritanam, you have to be moderate in consumption. Jalajunupailanam prasahanam cha sevanat dadya amla mastu suktanam Surasavirakasacha viruddhanam upaklinna putinam bhaktva diva praswapatam dravasnigdha gurunicha. See, all the causative factors, all the causative backgrounds, we have to classify them in 3 to 4 categories, like dietary factors, behavioral factors, and psychological factors. So behavioral factors also, you can see that diva praswapatam, that is the people who sleep in the afternoon, they are disturbing their liver. So when any patient of Yakruta approaches us, we have to look for all these causative factors and ask him or her about this. Atyadanam cha krodham, the psychological factors also. Bhajatam cha atapanalo, excessive exposure to the sunlight, excessive work in the heat, like the foundries, the cooks, no, where the heat is more and the fellow is working in that environment. Chardi vega pratighatat kale cha navasechanat, that is Rakta Mokshana. The Rakta Mokshana Vidhi which has gone wrong, something wrong has been happened. श्रमाभिघात संतापे अजीर्ण अध्ययनसा शरत्काल स्वभावाच्या शोणितम संप्रदुष्यति. So these kind of causes and causative factors, they are also found in Yakrit diseases, liver diseases. Next. So what are the major symptoms where we should suspect that something we have to look for? The hepatic disturbances, the hepatic diseases, we have to suspect that some liver disease has to be evaluated, investigated. Which kind of symptoms the patient presents us with, like fevers, constipation, anorexia, indigestion, loss of appetite, heaviness and pain in flanks or lung areas, varicosity in hepatic region, cough, headache, and chronic sinusitis, that allergic respiratory diseases. Now these symptoms, they have been mentioned by Datar Shastriji in his book. And what it means is that if you find the both ways we have to use these things, that if you find these symptoms, you go for investigations of liver and Yakruta and you treat Yakruta. See, in allergic sinusitis, rhinitis, there are so many allergic patients. But we never think of Yakrut in those patients. We only think of Pranava Srotas. So if you give any Yakruta medicine, that is a Phalatrikadi or Kumari Asa or Arogyavardhini, it will heal better and fast. You can experience, you take my word, you can see. When you go for the Yakruta treatment, these conditions will improve fast. So these different conditions, but they will indicate that some hepatic disturbances, hepatic diseases are developing or have developed inside. Next. Now what kind of different pathologies, that is we say the sampraptis. Samprapti. We have to be very cautious when any patient comes to us. We should go for the samprapti. We should define samprapti. There are many undergraduate students I can see. So the Roga Nidana, you have Nidana Panchak, you have Nidanam Puro Rupani, Rupani Upashas Tatha, samprapti. So these 5 points, they are the tools to understand disease. How to understand any disease? So we have to go for the 5 tools, that is Nidana, Purva Roop, Roop, Upshay, Anupshay and Samprapti. So any disease condition can be totally understood by all these 5 things. That's why the Samprapti, that is how from the ingestion of the causative factors, Nidana Sevana, the disease has progressed, or how this patient which has come to us in a particular state of a disease, how he has arrived at this condition. The journey, the travel of all the hetus and their impacts on dosha, dhatu, mala, agni, srotasa have to be evaluated, understood, analyzed, and then we can define a samprapti. So when we go for any samprapti, in Panchabhautika Chikitsa, we go for the Mahabhautika samprapti conditions. To make it simple or make it familiar to what you have learned so far, what you have learned in Sanhitas, Charaka Sutrasthan has a adhyaya like Santarpana Apatarpani adhyaya. Yes, in Sutrasthan only they are given Santarpana Apatarpani adhyaya. So Santarpana Apatarpani adhyaya is nothing but these Panchabhautika concepts. The Santarpana is only possible by Prithvi and Aap Mahabhutas, and Apatarpana is possible by Agni, Vayu and Akash Mahabhutas. So we have to go deep. We have to go sukshma into samprapti and try to understand the doshas, the mahabhutas, and their gunas, which have been vitiated, prakopita gunas. So which gunas the prakop has occurred is mostly important. When we say that, as you know, all the sampraptis are one and same. Because we used to learn and then say, "Arey, isme kya hai? Wahi hai sabhi." That the doshas, they get vitiated from their causative factors, and they, they derange the dushas, and any disease is formed. So, while we are saying that vata is prakupita, try to define or try to understand while reading also by which gunas the vat has deranged or vat has prakupita. Is it by ruksha and chala gunas, or is it by shita and ruksha gunas? So it is these simple things can lead you to the easy and accurate diagnosis and treatment also, or in deciding which kalpas, which yogas you have to use. So this Prithvi and Aap Mahabhuta, the Prithvi and Aap Mahabhuta causative factors which increase Prithvi and Aap Mahabhuta, they will cause obstructive pathologies in liver. Tej Mahabhuta, they will create Varana Shotha, like inflammatory conditions, alkaline heat, that is Kshara Dharmi Ushnata. Yes. Kshara Dharmi Ushnata. What is the Kshara Dharmi? It is alkaline heat. The heat is divided in two types in Panchabhotik Chikitsa, that is acidic heat and alkaline heat. That is Amla Dharmi Ushnata and Kshara Dharmi Ushnata. Now Kshara Dharmi is Ushna and Ruksha. And Amla Dharmi means Ushna and. So, Ushna Guna is there. Ushna will be common. But Ushna is associated with which causative factors? Like Snigdha or Ruksha, it will decide which way this Tej Mahabhuta Vikruti will go. And alcohol and tobacco. These are the major causative factors for any liver diseases. Due to Akash Mahabhut, Vayu and Vayu Mahabhut, they are the subtle Mahabhutas, Sukshma Mahabhutas. And that why their mental or intellectual stress, exertion, traveling, malnutrition, all these causative factors, they will disturb the Akash and Vayu Mahabhutas, and they will cause the liver conditions according to their activities and gunas. Next. Now, which different conditions we see in our practice, what are their symptoms, and which medicines we use? That is, I'm going to talk with you. Yakrit Vruddhi, hepatomegaly. By simple palpation, you can feel that the liver has enlarged. Otherwise, on USG also, in sonography also, ultrasonography also, you can see the reports, different reports, and there they will see the liver is minimally enlarged, maximally enlarged. They will, if enlargement is much more, they will provide you with the measurements. So, hepatomegaly, Yakrit Vruddhi, the symptoms will be abdominal pain, fatigue, nausea, vomiting, and jaundice, loss of appetite, weight loss, discomfort in the upper right abdomen. These are the basic symptoms which any hepatomegaly patient will present with. Now, the medicines we use are Phalatrikadi decoction or Gugul. Phalatrikadi decoction, that is Phalatrika Amruta Tikta Nimba Kairata Vasakaihi. This is the decoction mentioned in the Sharangdar Sanhita. In Sharangdar you can find this Phalatrikadi Kadha. Datar Shastriji extensively used this Phalatrikadi decoction, and we also use in, you can use it in freshly prepared decoction, or you can prepare arishta from it. Arishta also you can prepare, or you can prepare Gugul from it. That is Phalatrikadi Gugul we use. Now Phalatrikadi Gugul, only thing to increase its shelf life, उसकी सवीर्यता अवधि बढ़ाने के लिए, increase its shelf life. By definition, any Gugul Kalpa is named as Gugul when there is a 50% Gugul in that combination. But to increase the shelf life of any kadha or any perishable things, Datar Shastri use 20% Shuddha Gugul in any decoction, and we prepare this. So at least 2 to 3 years that kalpa can be used. So this is Phalatrikadi Kadha or Phalatrikadi Gugul or Phalatrikadi Arishta. In all the three forms you can use. Rajani Yog. Rajani Yog is a combination of Shuddha Gairik, Shuddha Girij and Haridra. And the combination has given the 3 bhavanas of decoction of Haridra. So this Rajani Yog, this is very important medicine in Panchavadik Chikitsa, which is used to decrease the effects of alkaline heat, that is Ruksha and Ushna Guna Vruddhi. When the Ruksha and Ushna Guna Vruddhi is seen in the Rakta Dhatu, we use Rajani Yog. Arogyavardhini. Arogyavardhini, everybody knows that is the main drug of Yakruta. But Arogyavardhini, if you read this shloka, it says that Deya Panchadine Jate. You have to, from first day, you don't have to use Arogyavardhini. You should not go for Arogyavardhini on first day. Like in Jwara also. Jwara. In Jwara Chikitsa, what they have said, that you give first kala to Jwara to pacify. Otherwise, you start treatment after 3, 5 or 7 days. That they have written. So, Arogyavardhini, as it contains various bhasmas in it, in Panchavadik Chikitsa, we use Arogyavardhini after the basic Yakruta restoration is done. That is, all the liver function tests, they come to normal. Then only we start Arogyavardhini, which will be used for the improvement in Dhatvantargata Pachana. That is a metabolism, on the molecular level, it will improve. So Arogyavardhini should not be given as a first line of treatment. Shiva Danstradi Gugul. The Shiva Danstradi Gugul is the improved form of Gokshuradi Gugul. The Gokshuradi Gugul you know, and Gokshuradi Gugul is processed with a bhavana of Gokru, Dhamasa and Pashan Bhed. Now in the regular part of Gokshuradi Gugul, you add this bhavana of Gokru, Dhamasa and Pashan Bhed. So this Shiva Danstradi Gugul is formed. And Shiva Danstradi Gokshuradi Gugul, basically it is useful, it is given for Mutrava Srotasa, Shotha, but it has a Pachana properties. More Pachana properties, Ushna properties are there. That's why if you give this Gokru, Dhamasa and Pashan Bhed, the bhavana to it, it improves its range, no? And you can use it many conditions. So these are the main drugs in Yakruta. Phalatrikadi Gugul or Kadha or Arishta, Rajani Yog and Shiva Danstradi Gugul. Next. Yakrit Sankoch, that is cirrhosis. Cirrhosis liver. There are many patients which we see that there are cirrhosis, cirrhotic symptoms are there, like weakness and fatigue, muscle cramps, weight loss, nausea, vomiting, upper abdominal pain, easy bruising and bleeding, and jaundice. And that's why the the process, if continued, the liver shrinks in size. The size of the liver goes on decreasing. That is, the sankoch avastha is there. Like when there is some injury there, and if that injury doesn't heal well, we have to, you can see that there is a scar, like there is scarring in liver, which leads to the cirrhosis. And what means cirrhosis? That the secretion of bile goes on decreasing. The functions of the liver, they go down, and that's why various causative factor and its effects on our body. Now in udara, that is ascitic conditions, as I heard from Samir sir, he was saying, answering your questions in like udara. You can treat udara very nicely. Many udara patients, they will respond well to Ayurveda treatment. And main is Nitya Virechana, that is Virechan. The Virechan Dravya you use and choose wisely. So all these Virechana Dravyas, along with the Jalasanchiti, how to get rid of Jalasanchiti. You can get rid of Jalasanchiti in two ways. What modern medicine does, they prefer diuretics. That is, getting out that excessive water by the urine way. But Ayurveda has mainly advised to go for Virechana, that is from the feces. We have to get out the excessive water in our body. So for that, the Gomutra is there, Haritaki is there, Triphala is there, and we in Panchavati Chikitsa, we use this Phalatrikadi Kadha, Gokshuradi Gugul, and we sometimes use the drug named Harlu. Harlu is a totally the powder of the panchang of the plant Celosia argentea. That is, in Marathi we say the kurdu, the name. Now it starts from appearing in the empty fields, and up to Diwali, it ripes, the seeds are formed, and then we collect it, the panchang, we dry it, and we powder it and use it. So it is also a good Shotahara Tridosha Shamaka Dravya, which can be used in the getting out the simple diet for the patients. After the Yakruta Sankoch, that is the main, the next is some kind of jaundice. Jaundice, we can see that is Kamala, and I think Samir sir has elaborated on jaundice. But what I want to see is that there are, as you see, there are 5 types of viral infections. You can see A, B, C, D, E. And the viral hepatitis A is easily treatable, and B and C, they are tough to treat. But we can treat, and we can also see the patients seronegative of hepatitis B. I have some case discussions. If we can start these slides, I'm going to tell 3-4 cases of liver disease treated by Panchavatik Chikitsa. So different kind of jaundice we can treat, that is obstructive and viral hepatitis. That is, we say the Ruddapatha and Bahupitta Kamala. So Ruddapatha is there some kind of obstruction in the way of the Pitta, that is Pachaka Pitta, which is coming. Next. So the jaundice is most common of liver diseases we find. And in the society, the lay people, they firmly believe that there is no medicine for jaundice in modern medicine, but Ayurveda has good medicines. And that's why many patients of jaundice approach Ayurveda physicians for treatment, and we can treat them well. So, the jaundice patients like the Bahupitta and Ruddapatha. Bahupitta are easy to treat, but Ruddapatha, sometimes they have to be given more medicines. More time they require to get cured. So in jaundice, the major drugs are Phalatrika, the decoction, Rajni Yog, Shwa Gugul, Tamra Bhasma, and Arogyavardhini. Tamra Bhasma is Shita and Laghu Lekhana. So Tamra Bhasma should be included in any jaundice patients. It is a very fantastic drug. Only thing is that the bhasma should be prepared well, and it should not offer any toxicity to patient. So Tamra Bhasma is a great drug to use in all the jaundice Kamala patients. In Ruddapatha Kamala, the juice of radish, that is Mulaka Swaras, मूलकस्वरस, ज्यूस ऑफ रॅडिश, मुळा ज्याला म्हणतो आपण मराठीमध्ये मुळा, त्याचा रस, it is greatly helpful in Ruddhapada It is definitely used in relieving the obstruction of liver. Next. Yakrit odor, that is ascites, that is we have discussed the swollen abdomen that feels heavy, uncomfortable, rapid weight gain, shortness of breath, Shwasakashtata, nausea, vomiting, swelling in the ankles. So these are the basic symptoms of ascites, and we should always give this continuous virechana is there, and go dugdha for 42 days at least. If the patient is not cooperative, give the go dugdha as much as possible. If he can consume, but try to avoid simple water and keep him on Godugdha only. So the Udara patients will get cured early. Then Rohitakarishta. Rohitakarishta is a drug which is very much useful when both Yakrit and Pliha, that is liver and spleen, are involved. When both are involved, the drug of choice should be Rohitakarishta. You should include Rohitakarishta in your prescription. Next. Pittashmari, bile stones. Nowadays, so many patients of Pittashmari bile stones come to us. The majority, the bile stones, they are there for so many days and years also, and they have caused no any discomfort to the patient. They are lying there sedentarily, without any symptom, without any discomfort to the patient. But for somehow in sonography that the bile stones are seen, and the patient starts another kind of disease. That is sudden pain in right upper part of the abdomen, which is commonly severe, few hours after food, fever, severe pain in upper middle part of the abdomen, right shoulder tip, pain in between the shoulder blades. So this kind of symptoms, the radiating pains and acute pain in acute condition of bile salt which is obstructed, impacted, you can see. In sedimentation type, that is of Prithvi and Aap Mahabhuta type, that is Phalatrika, the decoction, Kutki. Kutki is individually, independently, as a single drug, you can give Kutki. In Panchavadik Chikitsa, Datar Shastri has advised, if you want to use any single herb, give at least 3 bhavanas of that herbs to that herb and use that. So Kutki with 3 or 7 bhavanas we can give. Eladi Yog, that is also Eladi Kadha from Sharangdara Samhita, which is used in all types of calculi in Panchavadik Chikitsa. And in alkaline heat causative background, if you see that the Kshardharmi Ushnata, Paripatadi Kadha, Rajani Yog, Shva Gugul, they used in the bile stones. The bile stones, the problem is that the common bile duct is very small. It has a very small opening. That's why these bile stones, they cannot pass easily, unlike the kidney stones, the renal stones, because the renal stones, the excreting path, it gets bigger and wider, so the stones can pass easily. But in bile stones, they cannot pass easily through the common bile duct, and that's why it is very tough to dissolve or break all these things. And you can control the symptoms, but the patient, if there is impaction is there or something, you have to go for surgery sometime. Next. Other disease conditions where Yakrit has to be treated. The drug of Yakrit should be included. That is Malavibandha, the constipation, where Phalatrikadi Kadha, Paripatadi Kadha, Kumari Asav, and chinsa tel, that is anuloman tel we say, the tamarind and salt, sendava. And they are processed in um, the ग्राउंडनट ऑइल, ग्राउंडनट ऑइल शेंगदाणा तेलामध्ये ते बनवलेलं आहे, सिद्ध केलेलं तेल आहे. That is anuloman tel. When the patient says that his stools are hard and stony, you go for chansalavan tel. Pratishay ka shwas. With other medicines, use medicines acting on yakrut, because the mouse dhatu mala is shinghanak. So that's why the connection is there of yakrut with it. Mental or intellectual stress, if you find the cause of that, go for Jatamausi Fant or Saraswatarishta. So these are the medicines which are not mentioned or not directly connected to the liver or yakrut, but they act on the causative factors, causative backgrounds, the factors which help in disturbing or vitiating doshas. Next. So we know the Kaya Chikitsa, the definition of Kaya Chikitsa, that is samadhatu. You have to samya, restore this samya in dhatus, that is Chikitsa, nothing else. Next. Now Panchavatik Chikitsa Sutra, basically Panchavatik Chikitsa is a concept pioneered by Vaidyaraj Datar Shastri. Instead of Tridosha, if we go further, go deep, go sukshma with Pancha Mahabhutas, the diagnosis and treatment gets easier and precise. That is the basic concepts of Panchavatik Chikitsa. And it can be applied to any new disease conditions. We can use them and treat the patients. Next. Now this is the Chikitsa Sutra. These are the steps which are mentioned and which are taken in Panchavatik Chikitsa. As you know, every Vyadhi, Chikitsa Sutra is mentioned in our Samhita. Every Vyadhi. Like in Navajwara, Langanam Swedanam Kalo Yavagu Tiktako Rosa. Like in every disease, the Chikitsa Sutra is there. But in Panchavatik Chikitsa, the Chikitsa Sutra is mainly finding and defining the causative factor or background and its impact on our body, and treating the patient with keeping his bala. Keeping his bala intact is important. And lastly, apunarbhav or rasayan chikitsa. Next. Next. Now when we going to treat any diseases, the time of administration, that is Aushadhi Sevana Kala, is important, and we should follow that. We should never prescribe any patient that take one in morning, one in afternoon, one in evening, or one BD, 2 TDS. You should, as an Ayurveda physician, you should never go for it. You should be, because we know 10 to 11 Aushadhi Sevan Kalas. So we should stick to it and abide and ask the patient to follow those Aushadhi Sevan Kalas. Like 6 a.m., 10 a.m., 2 p.m., 6 p.m. we use because of the 4-hour period where we can see the increased dosha dominance. That is from 2 to 6, 2 a.m. to 6 a.m. the Vata is dominant. From 6 a.m. to 10 a.m. Kapha is dominant. 10 a.m. to 2 p.m. Pitta is dominant, and again also. So these this cycle should be used to give the treatment and the sandhikal of those cycles. Next. So we should use all the Aushad Sevan Kalas in our patients. Dosage. The Panchavatik Chikitsa medicines, the important is their dosage is very small, 100 mg, 150 mg, 40 mg, 30 mg, because they are prepared meticulously and they are given correctly. Next. Anupana. We should always also look for Anupana and use good Anupanas and specific Anupanas when we use our medicines. Like warm water, honey, ghee, jaggery, edible gum, cold infusion of coriander, almond oil. Like there are so many different kind of anupanas are used in Panchavadik Chikitsa. And in case of liver diseases, as I said, the Mulaka Swarasa, the juice of radish is important. Next. I will share some cases with you and I will stop. Pittashmari, the impacted gallstone. Next. The patient which was a psoriatic patient. He was suffering from psoriasis and chronic asthma. And he used to get steroids and methotrexates and all these things. And due to this, and he was a civil engineer, so he was working in the sun and irregular meal times and all these things. So he developed, in one fine morning, he started acute pain and he get admitted to the civil hospital of Miraj. And then he was investigated and the surgeon said that you have the impacted gallstone of around 10 mm, that is 1 centimeter. And that's why you have to give, and we don't have any facility here in our civil hospital. So you go in a private practitioner for endoscopic surgery. So they inquired about the price and it was very high. So they said we cannot afford such kind of expenses. And that's why that patient came to me, because the patient's mother, she was my patient and I have reduced her bile stones. So he said that I will go to this Ayurveda doctor. So he said, that surgeon said of civil hospital, that you will develop a jaundice, obstructive jaundice, and then you have to take. So he said, no, I will go to my Ayurveda doctor and you give me the relief order against your advice. Then she said, please connect me with your doctor. And that lady surgeon, she talked with me and she said that the patient is saying that you were going to treat him and all these things. And I said, yes, I will try to treat him, no doubt. But if the jaundice or obstruction is increased, I will definitely advise him for surgery. So he came to me and I started the drugs like Phalatrika the Kada, Ela the Gugul, he was vomiting like, so Lagusu Shekhar, Tamra Basma, Jingi Shardi. Jingi Shardi is Manjishtha and Sariva. Manjishtha and Sariva. And Varangaka Kshar, that is a Kshar in Udara Chikitsa. Next. So I have some, I don't think you can see clearly, but there was a impacted distal CBD calculus of 9.4 by 7 mm, and that was causing his acute pain and acute condition. After starting our medicine, the patient started feeling well. His pain in abdomen decreased, his vomiting stopped, and all these things. Next. Then, that is in the next report, mild dilated intrahepatic biliary radicals, and that the stone, it entered the gallbladder, which was stuck in intrahepatic in liver. It went down and it measured 10 mm. Next. And after 4 or 5 months, it reduced to 6 mm. You cannot see, I think, but it reduced to 6 mm. And the patient is fine. He's taking my medicines for so many years and so many things. So such kind of things also we can handle and treat with Ayurveda, like emergencies also. Next. Gulma, that is a liver parenchymal disease. The patient came with the diagnosis of liver parenchymal disease. And Basically, he used to go to gastroenterologist and he advised some drugs, but he was not feeling well. His abdominal discomfort, bloating, loss of appetite, gases, बहुत gases होते थे उसको patients को. So he was not happy with the modern medicines at all. So he approached me and उसका एक special child, he has a special child with him, and that's why his routine was very much disturbed. His mental health was also not good because he had to deal with his special child. So increase in the stable viscera properties, rasarakta kapha, rakpaka in yakrut, that is ushma, and there is hemangioma, and there is liver parenchymal disease, and all these things. I give this Falatrika di Gugul, Harlu, Lagu Suchekar, Rajani Yog, and Chinsa Lavantel. I said that for the constipation. Next. Now when he came to me, the SGPT was more, SGOT was more, and he has a albumin of like 1.44. So not much obstacle there, but there is mild jaundice. Next. And can you see? No? You can see? Mala disat nahi. Kai disat. ओके इसको बोलते हैं ना कि हैप्पी एंडिंग है, तो आप समझ लो इसका क्या है. सो दिस इट्स थिंग इज के देयर वाज अ हेमेंजियोमा देयर, liver, the echo texture of liver was not good, and all these things were there. Next. So after 4 or 5 months, all the liver function tests were normal. The patient was also clinically well. These symptoms were gone. Next. And his sonography report also came normal. That is, liver is normal, no hemangioma, nothing else. All the normal reports were there. So such kind of things. But my diagnosis was gulma. I offer treatment of gulma. You should not be, disturbed by the diagnosis, the modern. The big names of the diseases of modern diagnosis. We should not get disturbed with that. We should go for our Ayurveda diagnosis and Ayurveda treatment. The patient's symptoms will get care. Their reports will also get care of it. So everything will be good. होते क्या? I think I had some 2 cases more. The one is of hepatitis B, which has gone seronegative. As Samir sir has says that we can at least acute hepatitis B. It is easy to get seronegativity early, but in chronic hepatitis or carrier patients, it is sometimes difficult for us to get the seronegative report. Next. The patient is of ubhayadharmi constitution, jaundice, mild fever, bloating, all these symptoms, constipation, insomnia, and this viral load was there. Viral load, at least in carrier patients, we should treat these patients as a leena dosha avastha. See, what to decide is important. How to decide on a avastha of Ayurvedic point of view is the key to our success in clinical practice. Now, if you go for what you are seeing and you go for any Vata, Pitta, Kapha and Vaman, Virechan, Basti, it will not help. You have to go for a specific avastha, specific conditions of those dhatu mala, decide it, decide samprapti, decide where to bhanga that samprapti, where to You have to get rid of that samprapti, and then you can treat the patients. That Falatrikadi, Lagusu Chekar, Jingishar. The medicines are one and same. The medicines are one and same in all the patients, but we can treat all the different conditions with the simple drugs. Next. So this is the first where you can see the positive hepatitis B. Next. And in next, there is a negative report of hepatitis B. So you can get some fantastic results with Ayurveda. Next. Udara, ascites due to cirrhosis liver. So this patient came to us with gross ascites and loss of appetite, pada shotha, and he was a diabetic patient. Constipation, yellowish urine, tenderness, and basically cirrhosis. You can treat all kind of cirrhosis, and the elastograph of liver, which checks the elasticity of the liver, that can be reversed also. Next. See, the liver elastography, the 15 point something is his first value when he came to us. 15.5 kPa metavir. And after treatment, next. The patient is clinically stable. His ascites has gone. He is working fine. And now he has come to 11 or 12. So you can reverse the fibrotic conditions also. You can reverse the fibrosis also with the help of Ayurveda. So that is a very great thing to achieve, because otherwise these patients, they go on for they get advice for liver transplants and all these things. So with so many liver conditions, you can get great results. Next. Okay, so thank you very much. And for more information, like Panchavatik Chikitsa I said, you can, we have this drugs with us, we have some publications, we have stall also outside, and we run a course, online course of Panchavatik Chikitsa for postgraduate course, online course. And for last 10 years we are conducting, 2015, and it has given us good doctors. We have trained so many doctors in India and abroad also, and they are using these Panchavatik medicines and principles. I once again thank you for your patient listening, and all the best. Thank you.
Thank you, sir. Your expertise and experience brought value to our program, and we truly grateful for your willingness to share your knowledge to our participants. Your continuous play the vital role in anticipating deeper learning. Thank you so much, sir. So now this session is open for the question and answer. If you have any questions, let's ask. Yes, any questions from delegates, participants? ऐकणार आहे.
नमस्ते सर. सर, क्षारधर्मी उष्णता मतलब उष्ण रुक्ष और आम्लधर्मी उष्णता दैट इज उष्ण और स्निग्ध, उसमें डिफरेंशिएट कैसे करना चाहिए? लक्षणों में क्या फर्क होता है और हेतु से कैसे कर सकते हैं?
Basically, this Amla and Kshar concept is derived from this Madatte Chikitsa. In Madatte Chikitsa, you get the shloka that Ksharo hi ati madhuryam shigram amlopa sanhita. So it's kind of acid-base balance. You can relate it with acid-base balance. Basically, these are the conditions related to the Tej Dhatu or Pitta Dosha. You have heard in Sharirik Kriya and ever that Sadrava Pitta and Nirdrava Pitta. So these conditions are there. That is, when the Sadrava Pitta, that is where Dravata is there, along with the vitiated Pitta Lakshanas. But in Nirdrava Pitta, there is a Rukshata is there along with Pitta Dushti Lakshana. That is the main difference. Like in the case of Urdhvagamla Pitta, you can get two conditions where the patient says that he has nausea or vomiting. So that is a Drava Pradhana Avastha. But he says that is only heartburn is more. So that is a Kshardarmi Avastha. So such kind of mentions you can find in many conditions and you have to look for that.
Excuse me, sir. Please tell the preparation of Singanaka Dravya which is used in Pratishay का आश्वास.
Sihanat?
सिंगानक द्रव्य जो प्रतिशय का आश्वास में यूज किया था आपने.
कौन सा?
प्रिपरेशन सिंगानक द्रव्य.
Singanak. No. Singanak is Mala. Singanak is Mala. Mouse Mala. Mouse Mala is Singanak. So the it's in relation to Yakrut I was trying to explain or highlight, because this is Rakta and Mouse Pachana. It helps in Yakruta, and that's why this Nasa, that is the seat for the Pratishay, Jirna Pratishay. So there you should treat the you can see the Mala Vruddhi, the mouse Mala Vruddhi, and that's why when the mouse is Dushta, you have to treat Rakta and Rasa which are behind them. So that's why we use especially we use Kumari Asava in chronic sinusitis and rhinitis patients, and they give good results. That was the relation of Shinganaka with Pratishay. Thank you.
Thank you, sir. So I request all the dignitaries, Dr. N. Magdum sir, Dr. Savanu sir, principal, Pankaja madam, Chaugule sir, and our vice principal sir, Ramgonda Patil sir, for felicitation of Dr. Aniruddha sir.
Thank you, Dr. Pawan, sir. My sincere request to please maintain decorum of the auditorium, dear delegates. We ask apology for your patient listening, even though there was a power cut. As you know, this is the rainy season and Krishna River is very near to our village. So with that, there was some problem with KEB. So, but still, cooperated us. So thank you so much for your cooperation.
So now we have reached the end part of today's function, that is valedictory. So now I request our chairman sir, Dr. N.A. Magdum, President SGS Ankli, to come on the stage, and Dr. Anirudh Kulkarni, Ayurveda consultant, Miras, Dr. Prasanna Saunur, Principal SGS Ankli, Dr. Ramgonda Patil, Vice Principal SGS Ankli, Dr. Pankaja Saunur, Organizing Secretary, HOD, Department of Kaya Chikitsa, and Dr. Vishal Chaugle, Organizing Secretary and HOD, Department of Panchakarma.
So just now we witnessed National Conference on Integrated Approach Towards Liver Disorder, Yakrit Sanjeevini 2025. We had 3 sessions starting from morning. First scientific session was by Dr. Sujay A. Kulkarni. His topic was metabolic dysfunction associated steatotic liver diseases. Second session was by Dr. Samir Naik sir. His topic was interpretation of LFT and Ayurvedic management of different liver disorders. And third was, just now you have listened, Dr. Aniruddha Kulkarni sir, management of liver disease by Panchabhautika Chikitsa. So we have reached to the valedictory function. I welcome all the dignitaries on the dais, off the dais, faculty members from different colleges, teaching and non-teaching staff of Dr. NM AMC, and all my dear delegates. Now may I request Dr. Anita Dalwai Madam. She is Associate Professor, Department of Kaya Chikitsa from SBG Ayurvedic Medical College, Belagavi, to share her opinion.
Good evening, everyone. Myself, Dr. Anita Dalwai, Associate Professor, Department of Kaya Chikitsa from SBG Ayurvedic Medical College and Hospital, Belgavi. Opinion about this college? This college is like sister institute to me because we were budding in 2019, and Dr. N.A. Magdum sir is a well-wisher of our college, a backbone to our college. So he knows me since 2019, how we have grown. So round of applause to him, as he was the backbone of our college. Thank you, sir. And about this seminar, the seminar was very good. All sessions were very good. And firstly, speaking about Kulkarni, sir, first time for me, I heard about MASH. I had heard about NASH, but never about MASH. So MASH was a new word for me. And metabolic, me and Dr. Samir Naik, sir, Dr. Advesh Arkeri, sir, and Dr. Asha ma'am from KC department will be seeing on the liver diseases. So getting good to know about MASH was a good thing for us, where even we got to know that even diabetes was also a cause for cirrhosis of liver in females especially. Because 2 days back, I got a patient who is non-alcoholic, but she ended up with cirrhosis of liver. There was bilateral pedal edema. Her creatinine level were 2.8. I was unable to diagnose why the cirrhosis of liver in female. So today I got a clear picture. As she was diabetic since 8 years, so diabetes might be the reason why she ended up with cirrhosis. And second session was my guru, Dr. Samir Naik sir, where I've been hearing since 15 years, since 12 years. So there's lots of wordings about him, and we have treated a number of diseases regarding liver disorder. And regarding last session, Panchabhautika Chikitsa, that was a good session to hear. Thank you one and all.
Thank you, madam. And the next, this is the time to acknowledge the talent of our best paper and poster presenters. So, I request the convention to open up for your feedback. If anyone is interested to share your feedback, come on the stage. voluntarily you can come and share.
We have UG student in front of us, Miss Devayani Deshmukh from Harogiri College. So she'll be sharing her opinion regarding the conference.
Hello. Good evening, everyone. It's been a pleasure being present here today, attending this conference on liver cirrhosis, starting from the first session where we got to know about MASH. Yes, it was very informative, being in final year phase. We've never heard about it in that detail. We never focused on modern aspects that much. But yeah, it was we got exposed to many new things today. For the second session, where we discussed about Kamala or jaundice. Yeah, we read about it earlier also, but we never tried to understand its actual mode of action or what the therapeutic aspects meant. And we got a clear picture of it today. And we ended the session with Panchabhautika Chikitsa, which was informative as well. And all in all, it was a good session and a great opportunity to attend this conference today. Thank you.
Thank you, Devyani.
Last chance, any other who is interested to share their opinion? Without one last opinion, you will not be getting certificates. No? Yes. So let us move on to the heart of this function, that is prize distribution, right? So most of them, I think almost 60 members presented papers and posters. They were across India. Delegates were across India. And the presentation was in two modes, online and offline mode. So I request Dr. Ramgund Patil sir, he is a vice principal of Dr. N. Magdum Ayurveda Medical College, to announce the prizes. Please, sir. One session which is still going on, so we'll be waiting for them last. But whatever is ready, that will be announced by sir now.
Thank you, Vivek sir. Good evening, all of you. Respected dignitaries on the dais, it is one of the tough competition regarding the paper presentation and on both modes, that is online and offline mode. The faculty and the PG students and the students, UG students. So first of all, the faculty first prize goes to Dr. Pradeep Dawde sir. So congratulations, sir, for the presentation. Please come over the dais. Thank you, sir. So online paper presentation from the faculty side, its award goes to Dr. Sunita Khurana from Parul University. So congratulations. Next, poster presentation. First prize goes to Dr. Dhanlakshmi Sampgavi, Bailongal College. Congratulations, madam. Please come over the dais. Thank you. Thank you, one and all.
Thank you, Dr. Ramgonda, sir. Now I request Dr. Prasanna Savnur, Principal, SJS Ankli, to address the gathering.
So, good afternoon, one and all. Morning in the inauguration session, I got very less time. See, I need a minimum 1 hour to talk because anyhow we have time till 5:30. Session is open up to 5:30, but I will not take not more than 1 hour. Okay. So anyhow, good afternoon to one and all dignitaries on the dais and off the dais, and my dear students. I am not going to take much time. Hardly I will take not more than 5 minutes. Okay. So for this concept of because the travel of this Yakrit Sanjeevini, I want to share this travel from the day when we have thought of this process. The first thought was between myself and our chairman, sir, Dr. Magdum, sir, regarding conduction of this conference. And I have called all the departments for this invitations to all the departments of our college. Then many of the departments were ready, but Kai Chikitsa and Panchakarma, they approached separately, but I told we go with the dual departments. Now onwards, we will go with the dual departments. So the concept was, this initiation was taken up by this approved for the Kai Chikitsa and Panchakarma, I think in the month of February. In the month of February, it has been approved. But due to this, what you can say, commissions or regulatory issues, because of inspections and examination schedules of the RGHs, actually we were supposed to conduct earlier. And there were some personal commitments also there within the department, so we could not able to come up because of marriages and other events in the departments. For that also was a schedule to, actually it was on the May 18th. The schedule was, it was on May 18th. Because of all these schedules and inspections and so many things what I have told, so we rescheduled to June 18th, that is on today. But we thought of heavy rains today. With the blessings, we didn't had that much of, what you can say, this heavy rains. But for smooth conductions, usually showerings are necessary. So in the morning hours, we got good showerings of this Varuna Devata. So we got started very well. But which diseases has to be taken up? That was an issue. Because commonly, if we go for any national seminar on some common diseases or something, if they go, see, it may not be a productivity at the end, what the take home, what will be. At the end of the session, what you should be able to know, that is not possible. So at the end, there were so many thoughts were there. Then all of a sudden, some thought came up of this Yakrit. Then within no moment, these 3 speakers were selected within, I think, within 5 minutes. The proposals were unanimous. Within the spontaneous, these three speakers were selected, and immediately we contacted on the spot, and we got even approval from them also. That is for May 18th. I'm talking. Then we postponed it, and again we had a talks with these speakers. Then again they agreed for June 18th also. So in this way we got process, and see, being in the village, it's a village area. If we are there in the district headquarters, I think it is possible, anything is possible. But to conduct in a village area, it's a challenge what I have experienced today, because this is my first experience to conduct such events in village, because I have conducted many events in district headquarters, even capitals of national capitals also have conducted. But we didn't face any problems, because within a fraction of minutes, seconds we used to get it. But today's event of this shutting down of this, see, now everything is normal. The power is there, screen is there, everything has become normal. Lot of hurdles will come up, no doubt. But for this session, especially for last session, I think Panchabhautikatva, the concept what it was there, so it was decided by the Lord, God himself, that don't use any of these things, you go with the Panchabhautikatva and you give the lecture. So overall, the sessions, in my view, because it may be biased, but overall, all the three sessions were productive for all the graduates and postgraduate students, not only for these, even some faculty members also would have got benefited. And to have these events, there are so many hands are required. So all those, because of all those hands, we could able to conduct and achieve till now. Anyhow, organizing secretary is going to give Thanksgiving session is there for all of those people, those who have helped. But even then, they struggled a very lot for last more than a week, mainly last one more than a week. Especially for this food section, I really, because see, जो भी marriages होते हैं, जो भी marriages हो जाते हैं, उसमें लड़का कैसा है, लड़की कैसा है, कोई नहीं बोलता है. खाना कैसा हुआ है? I told them, see, the food should be very good, but no one has commented on food. Anyhow, the feedback was many more. Feedbacks were rare, good feedbacks. There was no feedback for food section, means everything went fine. That was a major challenge, because last moment registrations were increasing. Actually, we were expecting only 100, 150, and we were not ready to go beyond that also. By today morning at around 10 o'clock, from our registration committee, they came to me with a very, what you can say, tensed mood. Sir, we got 440 plus registrations. It was actually beyond our expectation. It was not expected. That's all because of the support of all the principals in and around Belgaum and throughout India. All principals have supported for these delegations. Because of this, I think this will have a step for this success. And for all these events, support, our backbone or back support is very essential. For that, always we, the chairman sir, our chairman sir, Dr. N.A. Mugdum sir, today also we were discussing a lot and future plans also. Hopefully that will also will announce shortly. His support was a lot. Some of you staff may not have come in contact with him directly, but we used to have a daily discussions and progress and everything of this event. For all the things he has supported, even he has support in such a way that nothing should go, what you can say, easy. You take it seriously and you do it whatever you want. No restrictions from financial to anything. Everything was granted. So that support is most essential, that causes success. And I take this opportunity on behalf of all of us present here, on behalf of faculty members and the management, that shortly we are going to announce, that is in the 2026 international conference in our new building with a new, what you can say, the auditorium, where you will have a 24 hours power supply with AC room, and every facility will be available in Ankli district. That will be announced shortly, within a month or two. It will be an international conference. Thank you one and all, for all the delegates, for your kind support. Thank you.
Thank you so much, sir. Next, we have the presidential speech.
A surprise is given by our chairman sir and principal sir to the organizing team. So may I request Department of May I request Dr. Ramgond Patil sir, Vice Principal of Dr. N. Magdum Ayurvedic Medical College, to announce the leftover prize, which I told actually.
The post-graduation section, the prize goes to Sangeeta SH, RAMC, Mangalore. Please come over the stage. Congratulations. I request our beloved President, sir, N. Magdum, sir. Give a big hand. Congratulations, doctor. I also congratulate the first registration of our conference. Once again, congratulations, madam.
Thank you, sir. So I was telling regarding one surprise. So from our management and principal, sir, they want to recognize the efforts from both the departments. So I request the Panchakarma and Kaya Chikitsa department staff, assistant professors, associate professors and professors, along with the organizing secretary, to please come over the dais. Management gonna recognize your effort. So please come over the dais, sir. Department of Panchakarma, Dr. Vishal Chaugule, head of the department. Dr. Gachinmad, sir, he is associate professor. Then we have Dr. Seema, Dr. Pooja, Dr. Savita Patil. So all the three are Kaya Chikitsa. We have Dr. Shruti, Dr. Pratibha Rani, Dr. Nandini Patil, Dr. Pradeep Dhavle, sir, he is a professor, and organizing secretary, Dr. Pankaja Saunur, madam. it really requires a very hectic job to organize such event in such small village. May I request the members of food committee on stage? Okay, so please be ready, all committee members, for photo session after vote of thanks. So now may I request Dr. N.A. Magdum sir for his presidential speech.
Good evening, everybody. Respected dignitaries, principals, faculty members, PG scholars, and students. Indeed, Saunur sir has expressed everything. As it is very difficult to organize such a conferences in rural area, that is true, sir. But the thing is, if you do an effort, you can do anything. That depends on you, and you have proved it. That is what. Same time, I would like to tell you, sir, that it is very difficult to establish the institutions in rural area also. And this thing, almost all of the Ayurvedic institutions, almost around, I think, 70% of the Ayurvedic institutions are in rural area. Hardly around 30% of the institutions are in district places. And sir, I can tell you that I will be with you for all the things. Within the near future, we are going to enter this new premises and new campus. And there, you will definitely, I am sure that you are going to succeed in international conference, for which whatever the support is required for you, we are there from management. And you go ahead with this with your team, because I am very happy that your team is wonderful, and everybody are putting their own efforts in different angles. That's why this type of conferences are successful, and in future also. And in surrounding all Ayurvedic colleges, faculty members or principals and PG scholars and all, in near future, whatever the conferences we are going to have in our new campus, you please attend the conferences, so that these conferences will be definitely next conference, that international conference will be definitely, it will be entirely different conference, which is going to boost everybody. That's what I can say of this thing. At this moment, I cannot talk more, because everybody are in the mood to go back. That's why. So once again, I congratulate everybody for participating you in this wonderful conference, and thank you one and all.
Thank you, sir. Now may I request Dr. Pankaja Saunur Madam, Organizing Secretary, Head of the Department of Kaya Chikitsa, for vote of thanks. And then high tea is ready. So national anthem and then high tea.
A very good evening to one and all. So today it was not only a seminar, it was a journey across the knowledge systems, a celebration of how Ayurveda and modern medicine can walk hand in hand. So it is indeed a great privilege and honor for me as the Organizing Secretary of Yakrit Sanjeevini 2025 to deliver the vote of thanks on this momentous occasion. On behalf of the Organizing Secretary and the host institution, I extend my deepest gratitude to all who have contributed to making this national seminar a grand success. First and foremost, our heartfelt thanks to the chief guest, Dr. Shri Subhash Samkavi sir, for gracing this seminar with his presence, with the inspiring inaugural address. Your words have added immense value and encouragement to our efforts. I would like to express our sincere appreciation to our President, Dr. N.A. Magdum sir, the Secretary, Dr. Suresh Chogle sir, Treasurer Madam, Dr. Lalita Madam, and the Vice Principal, Dr. Prasanna Saunur sir, Vice Principal, Dr. Ramgonda sir, for their constant support guidance, and encouragement throughout the planning and execution of this seminar. A special vote of thanks to our distinguished speakers, and resource persons from across the nation who have shared their deep insights and valuable expertise on integrative approaches to liver health. Your contributions have immensely enriched the knowledge base of all the attendees. To our moderators and session chairs, thank you for your smooth coordination and time management, which ensured that every session was productive and engaging. We are grateful to all a team of dedicated individuals. I extend my warmest thanks to the entire organizing team, volunteers, and supporting staff who worked tirelessly behind the scenes to make this seminar seamless and impactful. Our thanks also to the sponsors and the collaborators for their generous supports and commitment to the promoting research and education in the field of liver health. Last but not the least, we thank the media, the technical teams for helping us reach a wider audience, for ensuring smooth communication and presentation throughout the sessions. Let us take forward the knowledge, collaboration, and inspiration from Yakrit Sanjeevini to further our shared goal of integrative and holistic healthcare. Thank you once again. Jai Hind.
Thank you, madam. One small notice for all of you. There are QR codes which are sticked over the walls. Please scan them for feedback. And bookstall is also there. You can go through it. Now, please.
There is a stall of books and medicines of Vaidya Datar Panchavotik Chikitsa Kendra, and some students, they want to take books with the set, complete set. So you can get 10% discount on offer value, MRP on that set. So those who want to get the sets, they get the discount on this the stall. Thank you very much, and I request Treasurer Dr. Amruta Madam to come, and we want to present the books for your library written by Datar Shastri and our trust.
Thank you, sir. So let us wind up this today's function with the national anthem. I request everyone to stand up for the national anthem.
Jana Mana Adhinayak Jaya He Bharat Bhagya Vidhata Punjab Sindh Gujarat Maratha Dravida Utkal Vanga Vindhya Himachal Yamuna Ganga Uchchal Jaladhi Taranga तब शुभ नामे जागे तब शुभ आशीष मागे गाहे तब जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे बोलो भारत माता की वंदे वंदे. Now high tea is waiting for all of you. I request committee members, please come one by one. Now it is time for food committee. So food committee members, please come for photo session. Next to be ready is reception committee, and then stage committee. And then rest of the faculties who are not there in the committees, they also to be ready for a common photo session.